Better living through health. Cancer is a silent disease. Although there are various policy considerations for early detection of cancer, questions remain about the effectiveness of the policy. Nevertheless, if I listen to the signals my body sends and solve the problem by responding to the signals, I will be able to lead a healthy and happy life as well as cancer. Cancer is often difficult to detect with the naked eye in its early stages. Therefore, in most cases, a diagnosis is not reached despite various tests in hospitals. How can we detect the signals of cancer and turn them into opportunities for health recovery? Let's learn about its symptoms. 1. Epigastric discomfort and indigestion persist. It is a common symptom of gastric cancer. If these symptoms continue to recur, it is good to undergo a detailed examination. 2. Abnormal discharge occurs. It is found in female cancers such as breast and cervical cancer. In the case of breast cancer, a painless lump of cancer may be palpable and discharge may occur from the nipple. In the case of cervical cancer, there may be discharge or bleeding in the uterus. Furthermore, as the cancer progresses and invades the surrounding organs, such as the rectum, bladder, or pelvis, hematuria, rectal bleeding, and weight loss may occur. 3. Dry cough, bloody sputum, and hemoptysis. Cough is associated with numerous diseases. Depending on the persistence and nature of coughing, it can be a variety of diseases, and in the case of bloody sputum is also associated with various diseases such as bronchitis, asthma, tuberculosis, and pneumonia, so do not make hasty judgments. Consultation at a respiratory department, chest radiograph, sputum test, and lung function test are required. In case of hemoptysis, check where the bleeding is coming from. Usually, middle-aged or older patients are more likely to develop lung cancer. It is difficult to presume and confirm the disease. After an accurate diagnosis, treatment to stop hemoptysis is necessary. 4. General malaise is the beginning of liver cancer. Most cancers have no specific symptoms in the early stages. This is especially true in the case of liver cancer. However, it is not a temporary phenomenon, but there may be a feeling of boredom that always makes the body drowsy, or symptoms of loss of appetite and weight loss may appear. Of course, these symptoms may be trivial, but in some cases, they may be warning signals from the body, so be careful. When liver cancer progresses deeply and becomes terminal, anemia, jaundice, and pain accompany it. At this point, it is often out of hand. This is why you should pay attention to minor symptoms. 5. If the symptoms of stomach are repeated for a long time, it is likely to be stomach cancer. Of course, it cannot be concluded that heartburn symptoms predict stomach cancer. Rather, it is more likely to be gastritis or stomach ulcer. Nevertheless, it is said that these symptoms should not be neglected because gastritis often progresses to gastric cancer when it develops. Not neglecting minor symptoms is the best way to prevent cancer, but it's not easy to cope with these symptoms because our lives always seem to be chased. In particular, if there is a lot of sodium in the urine, it is likely to be atrophic gastritis, which can lead to gastric cancer, so these symptoms must be dealt with appropriately through a change in the diet. Even minor symptoms may be a sign that cancer is invading your body, so you should listen to it from now on. 6. You can see pancreatic cancer in your stool. One of the effective health methods is to manage stool. This is because the condition, color, and smell of the stool can confirm the condition to some extent. When it is steatorrhea due to incomplete digestion of fat and the color is gray, it should be reminded that it may be the way to pancreatic cancer. Of course, when the symptoms of pancreatic cancer deepen, abdominal pain and jaundice appear, and in this state, it is easy to fall into an irreversible condition. In particular, pancreatic cancer has the worst prognosis and the lowest 5-year survival rate after diagnosis. So, if you look at the condition of your stool and try to make healthy stool in advance, wouldn't it be possible to prevent pancreatic cancer, which is often in the terminal stage, at the same time as diagnosis? 7. What are the common symptoms of all cancers? When the pathology of cancer deepens and reaches the terminal stage, different specific phenomena occur. These include jaundice in liver cancer, biliary tract, gallbladder, or pancreatic cancer, ascites in stomach cancer, and hemoptysis in lung cancer. However, common signs of cancer include anorexia, indigestion, and weight loss. This phenomenon is not a sign of any particular cancer, so most don't take it seriously. No action. I live somehow, and then it becomes a part of my life. As the disease deepens, secondary symptoms begin to appear. It is accompanied by anemia, pain, and bloody stools. The appearance of symptoms in our body is a kind of warning message. Your body has gone wrong, so take appropriate measures. But we usually ignore such signals. Keep in mind that ignoring minor symptoms can lead to major upsets. 8. Suspect laryngeal cancer or thyroid cancer if the hoarse voice lasts. If your voice has changed, you should be suspicious. It is not wrong to judge that hoarse voice is usually a pathological symptom. Of course, people who talk a lot professionally, such as teachers, singers, may develop a hoarse voice if they use their throat excessively. Likewise, thyroid cancer can also be accompanied by a hoarse voice in some cases, and similar symptoms include difficulty swallowing food. If the change in voice is detected and appropriate measures are taken, it can be prevented from going to cancer. 9. Inflammation is a generalized predictor of cancer. Gastritis, hepatitis, pneumonia, etc., all diseases with salt in the back are based on inflammation. Our lifestyle has established itself in a form that causes inflammation in almost all organs. The surrounding environment, such as overeating, chemicals, drug overuse, lack of exercise, sugar, refined salt, and additives, triggers inflammation. This kind of inflammation can be treated with diet, including herbal therapy, sports medicine, and psychological therapy, but if left unattended, it will be a shortcut to cancer. The fact that this kind of inflammation has a causal relationship with various cancers is being revealed one after another, so you have to be careful. 10. Dizzy. Anemia accompanies many cancers. Anemia is accompanied by two reasons. This is because various bleeding occurs in the process of cancer progression. One such phenomenon is caused by uterine bleeding, rectal bleeding, colon bleeding, and urinary bleeding. In another case, there are cases in which severe symptoms of anemia are experienced due to side effects of anti-cancer drugs in the course of treatment after diagnosis of cancer. Dizziness is a common symptom for everyone. We should pay more attention to the former. Bleeding that occurs inside the body is most often mixed with urine, feces, or phlegm, so you can see it with your eyes. Therefore, if you see blood in your urine, feces, or sputum, you need to thoroughly figure out the cause and then take appropriate measures. Paying attention to symptoms such as inflammation, bleeding, and anemia, now is the time to actively defend your body.